Hey everybody, welcome back to my channel. It's been a while since I filmed. It's now December 2024 and I decided to come back on and film because I was just scheduled for my next surgery. I'm actually currently trying to find as much information as possible about this surgery prior to having it, just by looking at the internet and YouTube as well. There are a couple people on YouTube that I've found that have had this surgery, but honestly there's not a ton of information out there. And everyone's case is so different as far as why they need this surgery, and there's different variations of this surgery. So I thought I would just sit down and film kind of what I'm currently going through heading into my APR surgery. Just a little disclaimer before I get started. If you don't like hearing about stomas or rectums or anything in the colon kind of region, this is probably not going to be the video for you. I'm filming this because I hope it helps somebody else if they are headed into this same surgery. Okay, so I'm going to start with a brief recap of why I even need this surgery, how I got here, in case you didn't watch the Why I Left Nicaragua series. I've had ulcerative colitis since 2016. Quite honestly, I think I've had it since about the age of 8 years old. It just went undiagnosed, unfortunately, but I got my diagnosis in 2016. I've trialed a lot of different medications and ended up on a biologic drug, and that put me into remission for several years. But I always knew that biologics were not something I wanted to stay on long term, just because of the side effects. There's some pretty significant side effects that can happen. And so I knew that my long-term game plan would be to eventually try and see how I did coming off the drugs. I knew that the risk of doing that meant that I could flare up again, and the thing with biologic drugs is once you come off them, your body can build antibodies towards them, and they can either not work or you can have an allergic reaction to them if you try and start them up again. So I knew that risk was there, but I also knew that I didn't want to stay on the drugs forever. They definitely had their place when my kids were a lot younger and I first got diagnosed. So I'm very thankful that I had them and it got everything under control. But I always knew at some point I would look at coming off them. So when my family decided to move to Nicaragua, that was a perfect opportunity to try, because that drug is not commonly available in Nicaragua. It is possible to have it imported, and when I first moved, I did have a dose imported, just because with the stress of moving, I didn't want to try coming off right away. So I did have one dose in Nicaragua, and then I basically stopped having any medication and just wanted to see what my body would do. And luckily in my situation, I went almost 3 years without a flare. I quite honestly felt the healthiest I had in a very, very long time. And I felt more in tune with my body as far as what foods were affecting me and different triggers and whatnot. And I felt very much in control. And for all 3 years that I was in Nicaragua, it was pretty healthy. Unfortunately, my family went through a very traumatic event, and that triggered an incredible ulcerative colitis flare. Ulcerative colitis is very heavily tied to stress, and this was an insanely stressful event that happened, and it sent me straight into a flare that was not stopping. The long story short, I ended up in a hospital in Nicaragua, and they did try the biologic drug again, and it failed, and ultimately I ended up having a decision to make as far as what surgery I wanted to have. I knew I wanted my colon removed, and I had come to terms with it because I had years prior to think about it and realize that that could be where I'm heading if biologics stop working. So luckily I already was kind of preparing myself for that, but again, I didn't think that the circumstances would make me have to choose the way that I did. I was very, very ill by the time I had to make that decision. I hadn't eaten in weeks at that point. I was extremely weak. I just remember my brain not processing information very well at all at that point, and I had about 2 days to make the decision on what surgery I wanted to have. Basically, I could choose a permanent or temporary ileostomy. So an ileostomy is basically when they remove the entire large intestine, the colon, and they take the end of your small intestine and bring it through your abdomen, and that is basically how you use the bathroom. So my small intestine is currently sticking out of my stomach, like about this much, and then I have a bag over top which collects everything that comes out, and I go to the bathroom that way. I could go way more into detail about all of that, but that's not what this video is about. But basically, I ended up choosing the permanent ileostomy. I wasn't interested in the temporary. That's where they'd have to create an internal pouch, which is called a J pouch. It's another series of surgeries, and it has its own risks as well. So I was kind of weighing out the pros and cons, and was pretty confident in my decision to stick with the bag. I'm happy with the bag for life. Now, once I did get back to Canada, I met with my colorectal surgeon, and he let me know that I actually still had the option to do the J pouch if I wanted to, which was a little bit shocking to me because I thought once I made that decision in Nicaragua, it was permanent. However, he said that the J pouch was still an option. So I did go through a bit more of just like weighing through the pros and cons and deciding if this is really what I want to do for the rest of my life. And I am very, very confident that this is what I want to do. I am not interested in more surgeries to try and create an internal pouch and dealing with that healing process, dealing with learning how to use the bathroom all over again. And then really it's the potential for pouchitis, which is where the pouch they create could also get ulcerative colitis, meaning that I still have the ulcerative colitis symptoms, and it is possible that the pouch fails and you end up with a permanent ileostomy anyways. So I'm glad I had that extra time when I was feeling better to really think through that decision, but I'm still happy with my decision. So that brings us to the APR surgery, which is abdominoperineal resection. Now, the reason I need this surgery is because they removed all of the large intestine, but they left the colon and the anus. And that's because in case I wanted a J pouch in the future, that's what would have connected that pouch to the rectum and the anus. And that's basically how it would have worked. However, since I am doing permanent, I don't need those parts. Not only do I not need those parts, they still have ulcerative colitis. So after my surgery back in Nicaragua, I started developing this mucus issue that I spoke a little bit about, and it was flaring kind of like an ulcerative colitis flare. Obviously not as intense because I didn't have a colon anymore, but it was very, very uncomfortable, and it started bleeding and ramping up. Luckily, when I got back to Canada, they gave me a prescription that has helped calm that down in the meantime. But basically, it's not good to keep your rectum if it's constantly inflamed and flaring, because the chances of developing rectal cancer are very, very high. It's not, my doctor kind of explained it, it's not an if situation if I keep it, it's a when situation. So it wasn't like I had to immediately go into surgery and get that out. It's just that I had to look at doing that sooner than later. So my surgeon basically told me I should look at having this surgery within the next year or so. I decided that the sooner the better. Obviously, I wanted to be fully recovered from the surgery that I just had in April. But once I was recovered, I felt like delaying this surgery was just delaying my life, if that makes sense, delaying my recovery. I just felt that the sooner I could get this done, the better. So I actually just got my surgery date this week, and it's going to be January 15th. I'm probably not posting these videos till well after, but it's currently the beginning of December, and my surgery is in about 6 weeks. So yeah, I thought I would just record my thoughts, record the process as I go through it. Hopefully it can help somebody else out in the future. Like I said, there's different variations, and I'm still honestly learning. Like, I feel like I could use a good session sitting down with my colorectal surgeon and really understanding exactly what the procedure is, because the information out there is so limited, and I still don't really understand why that is. But from my current understanding, the APR surgery is going to go in laparoscopically, so through my abdomen. I don't know if they're going to go through the same scars that I already have from the previous surgery, but either way, they're going to go in laparoscopically, and they're going to remove my rectum and then basically remove my anus. I don't really know the specifics about that. I'm guessing, again, this is going to be TMI, but I'm guessing they're cutting around it, which is cutting through a lot of muscle and through a lot of pelvic floor, and which is one of the reasons why I have a lot of nerves about this surgery. But ultimately, they remove the rectum and the anus, and then they sew you up. And it's often referred to as the Barbie Butt surgery, because you no longer have a butthole. It's still a crazy thought to wrap my brain around, to be quite honest. But once that's done, then all those parts are out, and they won't flare up with ulcerative colitis, and I won't have that risk of rectum cancer anymore. So It's very, very much needed. It's just a very, as you can imagine, intense surgery and intense recovery. So this is why I'm trying to gather as much information as I can leading into this, just so I can be mentally prepared. With the last surgery, I was so ill and it happened so fast that I really was not prepared for the recovery, and the recovery was extremely, extremely hard on me, again, because I was so sick when I went into that surgery and just due to the other stress that was happening in my life at the time. So this time I feel like I can be more prepared, and I want to try and be as prepared as I can. I am a part of a Facebook group for this specific surgery, which has been both really helpful and also kind of terrifying because obviously people post their bad outcomes as well. So it's been a blessing and a curse. But yeah, some of the things I know is that I'm not going to be able to sit for an extended period of time. Some people, I would say the soonest I've seen is like a month. Some people are a year out and still feeling uncomfortable sitting. The wound itself, as you can imagine, going right through the pelvic floor, it's a very big and very deep wound. It takes a very long time to heal, and being in such a dark and damp environment, it makes it extra hard to heal. So I've seen, a lot of people talking about complications as far as actually healing that wound. So anyways, I'm just trying to wrap my brain around what it's going to be like to not be sitting and for a very long time, and that includes driving. So I have different recommendations as far as pillows, like different cushions that I can sit on once I can sit, because I do know that the donut is not recommended. And yeah, I have other things that I've bought so far that have been helpful for people. So basically I figured I would just record this part of the video, and then the next part of the video you'll see will be maybe before the surgery. I'm not actually sure how I'm going to film this, but I do know that I want to talk post-surgery on just how it went for me and any insight I can give to anybody else who might be heading into this surgery. So yeah, I am very nervous about the fact that I'm going into another surgery because it's so fresh in my brain. I just went through one. I know what recovery is like, but I'm also trying to stay optimistic and remind myself that I'm a lot healthier this time heading into it, and it's a different type of surgery. So yeah, and if you have any questions at all throughout this process, definitely feel free to leave a comment down below and I'll do my best to answer. But like I said, it seems like everybody that I've read about has a totally different experience with this surgery. So if you are watching this and you are heading into this surgery, just know that whatever I go through could be completely different from what you go through, but I hope it is at least a little bit helpful. Okay, it's January 15th and it's the day of my surgery. It's 5 a.m. and we're on our way to the hospital, and I didn't really sleep much last night, maybe an hour and a half, and had my last cup of apple juice that I was supposed to have before surgery and this morning, and my last shower. My bags are packed. I'm feeling pretty nervous, but also calm, so I'm hoping I feel that way once we get there. I'm out of surgery. I'm feeling okay. I'm not feeling any pain because I have an epidural. The reason I have the epidural is because they had a CT scan yesterday, and I found out the results right before surgery that my rectum had a lot of scar tissue and was essentially stuck. And so my surgeon had said it's possible she may need to open me up instead of doing laparoscopic. So it's the day after surgery. I feel like I recorded something yesterday, but don't remember what I said. And I also think I got cut off because I'm in a semi-private room. So it's pretty much impossible to do any sort of updates, but my roommate just discharged, so I thought I would do a bit of an update. I don't even know where to begin with updates. I checked in yesterday morning. They had a hell of a time finding my IV. They got out the ultrasound and still took 3 tries with the ultrasound. So that took like probably 45 minutes just to get an IV in. And then I met with my surgeon like right before surgery. I hadn't met her before. I'd spoken to her on the phone, but I hadn't met this particular surgeon. And I had gone in for a CT scan the day prior because they didn't have any medical imaging from me since I had the other surgery in Nicaragua. Anyway, she had the results back and it showed that my rectum was, how do they describe it, shortened and stuck.
Yeah, had a lot of
and full of scar tissue.
Yeah.
And she was telling me that it's possible they might have to open me up instead of going laparoscopic. And that's when they made the decision to switch me to an epidural. Basically putting in the epidural before I went into surgery just in case. And so I didn't even have time to process that. That was not something that I was thinking was gonna happen. I thought we knew the plan, but anyways, I got the epidural and then got wheeled into the OR and then woke up in the recovery room and found out that they did have to open me up. It's a lower scar. I think it's about this big. It's vertical in like the pubic area. I haven't really seen it yet, but they did go in laparoscopically as well, so I have both incisions. And then of course the incision on my anus, which I haven't seen. No idea what that looks like. And I woke up with clavicle pain on the right side. They're thinking it's referred nerve pain from like the gas from the laparoscopic part of the procedure. But anyways, long story short, the epidural has been wonderful. I am so shocked by the pain control. Like, I really haven't had much pain besides the clavicle pain, which is above the epidural. I've been very, very fortunate. And so I have a little bit of nerves because tomorrow they're going to stop the epidural because I still have it, if that makes sense. I feel like I'm not making a lot of sense, but that's okay. Yeah, and so tomorrow they're going to be stopping that and moving to oral medications, and so I feel like I don't have the true sense of the pain that I'm going to be in yet because the epidural's been blocking everything. So I'm just trying to keep the right mindset, and then we're removing my catheter tomorrow as well. So that gives me some nerves as well, but I'm just trying to stay positive that part will go well. I just stood for the first time, which felt really good, except for this clavicle pain, which was like shooting sharp pain that made it hard to breathe. So anyways.
Second time
was better than the first time. Is there any other updates? They let me eat last night. I had some mashed potatoes. I was not expecting to be able to eat the same day. I've requested a private room, but there's no private rooms available, so. What else? I've got a catheter, a drain, like an abdomen drain.
Mm-hmm. Well, sorry, I just got a finger in the shot.
It's okay. I've got a catheter, a drain, an epidural in my back, ileostomy, of course.
And IVs.
2 IVs. And I had those tensor things on my legs last night for blood clots that I'm really not a big fan of, but luckily those came off this morning. So I just feel like I'm nothing but cords. I feel like I'm missing something too. Anyways, yeah. So I'll try an update. If I get another roommate though, you might not see an update until I get discharged.
And this is Allison's view of downtown Vancouver. The wall building and some construction. Some very dirty windows.
Just remembered one other thing. When she told me about my CT scan and possibly needing to be opened up. She said that my rectum was very, very close to my ovary, and she was going to try her best to save my ovary. And so that was another last minute piece of info I got right before heading into surgery. But luckily, they saved my ovary. So, but I wanted to mention that.
And your surgery was scheduled to be 4 hours long. With the potential for an additional 2 hours, and you went the full 6 hours, and almost 6 hours, 6.25 hours.
Yeah, so not 4-hour surgery, 6-hour surgery, but that's because it took so long to get the scar tissue out. Yeah, still kind of shocked by my current pain management. Like, it's crazy. I was expecting to be in a whole world more pain right now. And that doesn't mean that's not coming, but I'm very grateful for where I currently am. Okay, so I'm home now. I'm currently 6 days post-op. I wasn't able to record anything further in the hospital just because I had a roommate the entire time. And to be honest, I wasn't feeling the greatest anyways. But I got home, today's Tuesday, I got home on Sunday, which was 4 days post-op, which was a little bit quicker than they anticipated. They were going to send me home Monday, so yesterday, but I was doing so well that they sent me home on Sunday, which I'm very grateful for because it's always easier to recover at home. Hospitals, there's constantly people coming in and out of the room, and it's just not a comfortable environment to heal in, although I do miss the hospital bed, which I never thought I would say after being in one for so long, but the way that the hospital bed can go upright and help you get into an upright position, I miss that aspect. But otherwise, I'm very happy to be home. I'm very grateful to be home. I'm just gonna sit here and try and remember anything I haven't said yet and kind of update you at this point on my recovery. So the epidural came out the day after I recorded that last update, and I was really nervous about it because, again, it was blocking a lot of my pain. But they put me on painkillers, hydromorphone, on like an oral hydromorphone after taking out the epidural. And we're just kind of playing around with dosage of that to try and get the right level of pain relief. Definitely painful, hard to get comfortable in any position really, because there is such a big wound on the bottom. And then when it comes to sitting up, I've got all those staples and that big incision, and then just being on my bum in general is really not comfortable. I am walking. I did walk a lot quicker this surgery than the last one, and I definitely feel a bit more energy than the last one, like in more with it mentally, probably because I didn't go into it so ill. So I'm very grateful for that. Today is my last day on these pain meds, and then by tomorrow I'll just be on Tylenol, which is also giving me a lot of nerves because it's only been a week since surgery. I also ended up getting my period, unfortunately, the day, I think 2 days after surgery. And I just wanted to mention that because that just made things extra uncomfortable and like hard to manage with everything that's already going on down there. Ended up finding somebody on TikTok who recently had this surgery like 3 weeks before I did. And again, this is going to be TMI, so if you've made it this far in the video, like hopefully you're okay with TMI, but she was describing how without your rectum, your period or mucus or like discharge, whatever is in your vaginal canal, falls backwards into this like empty space where your rectum used to be, and then it just kind of like comes out all at once. And I'm very glad that I saw her TikTok before I went into surgery, because that is exactly what is currently happening. There'll be nothing for a long period of time, and then all of a sudden, so I don't know if that's going to be my
my new normal. But again, I'm sharing all of this to be transparent for anybody who might need this surgery. What else? I got my catheter out shortly after the epidural, and that gave me a lot of nerves because I've had issues after getting catheters out in the past, being able to go to the bathroom. So this time it took me probably half a day of like going in and trying and nothing happening and like being stressed about it, but trying to be calm about it. And luckily I eventually went and things seem to be continuing well. So very grateful for that. My brain's still not totally functioning, so I feel like I'm going to be forgetting information, but I was discharged with my drain in place, and I had to monitor the output, and once it reached a certain level of minimal output, then I was able to get the drain removed, and that's actually what we did this morning. Went to my doctor's office and had the drain removed, which I feel like is a huge step because it's just one less thing to manage on my body. And then the staples will be removed on Friday, so 4 more days from now, and I'll be going and getting those removed. And then yeah, it's just the wound on my bum. So again, like I mentioned at the beginning of this video, it's so hard to get information on like specifically how this surgery works or what it's supposed to look like. And I've had multiple phone calls with my colorectal surgeon and the one who ended up doing the surgery prior to this to try and understand the best of my ability, like what is actually happening down there. And I thought I did for the most part, except for the current state of the wound. And again, without getting into too much detail, I just assumed everything would be removed and then it would be sewed up. So there'd be like, it's dissolvable stitches, I know that. But in my case, I have like kind of a rolled up flap of skin, like wedged in there, if that makes sense, and then sewed up. And so I do remember the surgeon coming in at one point and saying, if you feel something there, just know that it will go down over time. It will smooth out. But again, I was not with it when she was there telling me this. And so I'm just being honest in the fact that I've had the surgery and still don't quite understand my own body or what's going on down there. I know that I can't really sit. I can't really do certain movements, like I'm trying to keep my legs closer together when I move. It's not bleeding profusely, like I have a pad back there to collect fluids and stuff like that, but it's nothing extreme. It's definitely uncomfortable, but anyways, my next follow-up is in a month. And I don't want to post these videos until I really understand myself what is happening, because the point of these videos was to share what I've learned about this surgery. And at this point, I can't believe I've had the surgery and I'm still not exactly sure what's happening down there. So I think I might reach out to my surgeon and just get her to explain it to me again now that I'm more coherent, so I can just understand, like, is that what the wound is supposed to look like? And like, what is the end outcome? Because as far as my understanding of the end outcome, my butt will be like a Barbie butt, like the same as a normal butt, just without the asshole, essentially. But right now, that's not the case at all, and I can't see how where I am now is going to lead to that smoothness. Anyways, so I think I'll reach out and try and get answers on that. And then, yeah, I think that's it for this update. I'm doing okay. I'm happy to be home. I am trying my best to find comfortable positions, trying to have a positive mindset. And there'll probably be one more part to this after this, where hopefully I have the answers to what's going on with my bum. And that'll be this video. Okay, so I'm currently 2 weeks post-op today, and I thought I would just update where I'm at. I've been on just Tylenol for pain medication for the past week, and I've been managing okay for the most part. The wounds on my front definitely are a lot less sore. The wound on my bottom is increasingly sore, and I'll get into that in a minute. But yeah, I'm managing okay for the most part. I had the staples removed on Friday. So 5 days ago, I had all the staples removed, and that actually went better than I thought it would. I was a little bit nervous because I had so many staples, but luckily that all went well. Sleeping has been a little bit interesting this past week. I'm constantly tired, and not just like sleeping tired, like just exhausted, like my body's trying to heal tired. But I have been going to bed around like 11 or 12. I can't seem to get to bed before then, and then my body wakes me up around 4 or 5 a.m. So I'm not sure if that's just because of the routine I had at the hospital or the medication, or it's just the way my body is right now. So anyways, sleep's been challenging, but I try and sleep during the day when I can. I've been making an effort to walk more every single day, so I'm still not walking very far. Like, I think a block is probably the longest that I've gone, but I've made an effort at least the past 5 days to get outside and try and just walk and see what I can do. I'm walking very, very slowly, but it's not too painful. It's just building up that endurance again and getting over that level of exhaustion. So on one hand, I'm trying to prioritize resting and recovering because I know my body needs it. And on the other hand, I'm trying to like slowly build up endurance and start moving again. I'm still not sitting on my bum really at all, mostly just laying on my side, kind of like I am right now, or fully laying down and then standing and walking when I can. But 2 nights ago, I had my husband check on my wound on my bottom because I shower and pat it dry every night, and that's kind of the wound care that I have going on. So I just have him take a look. I don't know why. Like, I'm normally not squeamish about these things, but for some reason I have such an aversion to looking at the wound that's on my bum. So while I'm feeling that way, I'm having him check on it just to make sure that everything is looking okay. And 2 nights ago, he noticed that a bunch of the stitches had ripped or popped. They were missing, and it was actively bleeding. It really honestly hasn't stopped bleeding since I left the hospital, but it's not like a large amount. It's more like weeping and bleeding. But this was a little bit more blood than before. And again, because some of the stitches were missing, we were a little bit nervous. So I ended up emailing my surgeon's office that night, and the receptionist actually replied, which was amazing, and asked me to come in the next morning. So yesterday morning, we drove back into Vancouver and met with the surgeon just so that she could have a look at it. And I'm really glad that we did that. It just like gave me peace of mind. I was able to ask questions also about like what's actually going on down there, because I thought I understood the surgery, but I didn't understand all the parts of it. But anyways, there are some stitches missing, but she's not too concerned about it. We're just gonna keep on doing what we're doing and like resting and healing and walking when I can. No changes to that. She said some of the draining could be coming from my abdomen from the surgery and like draining through that site, which is kind of gross to think about. But anyways, she's not worried about it, which is good. She gave me things to look out for if anything changes that would be concerning, to let her know. And then, yeah, I just thought I would explain again. This is so TMI, but the reality of this surgery, and these are the answers that I was looking for specifically when I knew I was booked for this surgery, that I was having a really hard time figuring out. Please keep in mind that this surgery can be done in so many different ways, and it also depends on your body at the time. Like, there's people who go through radiation and chemo, and they might have a completely different surgery than I do. There's lots of variations, but in my situation, and the way she explained it, is that the rectum was removed and the internal sphincter was removed, because your anus has an internal sphincter and an external sphincter. So the internal one and the rectum were removed, and then the external sphincter, and this is so hard to describe. Even she had a hard time describing it and like trying to draw a picture, but like all the flesh around where the butthole essentially used to be, they gathered all of that together and stitched it. and then stitched it in a line kind of along my butt crack. So that excess skin that is kind of protruding from that area right now is because they gathered so much of it, because it is such a large hole to heal with all the missing parts. The more skin they can suture down, the better. So again, gross, TMI, but that's what the excess skin is. It's just like all the surrounding skin being sutured together. She said that the remaining stitches should dissolve in about 12 weeks, and then this surgery, which I knew takes up to a year or sometimes longer to like fully heal. Once it does fully heal, that excess skin that's in there should basically scar down, and eventually it'll just look like I have a little scar in my butt crack, no longer a butthole. So in case you were curious, because I certainly was, I didn't fully understand like what was going on down there, but that's what's going on down there, and hopefully at some point I actually can build up the nerve to look for myself. I'm not there yet, but I know that one day I will. Anyways, I think this is a good place to end this video. If there are any questions or anything, I might do a follow-up video in the future. I know this is not a very common surgery, so I'm not expecting a lot of questions. Or if you come across this video well down the line and you just want to leave a question down below, I'll do my best to answer. One thing I didn't talk about is stuff that I brought to the hospital that might be helpful. I don't know if I mentioned this in the video thus far, but I did buy a shiwi. A shiwi is a thing that you can stand up to pee as a female. And because I heard other people talking about that who had this surgery, and I will say that that has been very helpful for me, because sitting down to go pee is painful and difficult. So doing it standing up right now while things are healing, I would definitely recommend a shiwi. So yeah, but there are other things that I could probably make a video about, but I thought I would just put this video up first, and if you have any questions, let me know, and thanks for watching. Bye.